Try not to become a man of success, but rather try to become a man of value. Albert Einstein. Welcome to Living at Your Finest podcast. I'm your host, Dr. Babs. I'm a triple board certified family, obesity, and lifestyle medicine physician, and I am the founder of Living at Your Finest Wellness, a holistic direct primary care practice. Did you know that 80% of lifestyle-related chronic diseases within our communities are preventable, with poor diet being the primary culprit? Now, contrary to what we thought, that it was our unfortunate genes, the good news is that we can make changes together to improve our health and quality of life. So that's what this podcast is all about. The Living at Your Finest podcast is devoted to helping families to live at their finest well-being using a holistic approach with a healthy lifestyle to nourish and flourish as a whole, vibrant, and healthy champion. So join me and my guests as we share transformational and sustainable skill sets from our health and wellness journey to support you and your families in achieving optimal well-being. Ready to live at your finest? Well, let's get to it. Health champions, welcome back to the Living at Your Finest podcast show. How are you? The month of June is wrapping up, and I thought I have to talk about men. I hope you're not going to be upset with me, but our topic today, it's a little bit intense. Real men get checkups, no shame, just strength. But before we get to that, I just want to make sure that you're doing well. I want to check in with my wonderful listeners. Thank you so much for downloading and tuning in and sharing with your friends and families. You are the reason why I keep this podcast going in its fourth year. So I'm really honored and I'm grateful to you. So this month I thought, you know what? I don't think I've focused on men in particular on my podcast, and I think it's important to do so. So we're going to be talking about men's health, right? So June is special for all men, and every month is, but more so in June. And it's a nationwide focus that turns to men's health. And why is that? Because in history, men have been notorious for not going to the doctor. They're strong, they take care of their families, but they just put their health in the back burner. I spoke to a potential patient who came for a meet and greet, and he told me, I have not seen a doctor in 12 years because he's so afraid of what they will tell him. And I was, not knowing, absence of mind, it really doesn't benefit anyone any good to do that. So today we're going to talk about the importance of checkup and what kind of checkups and how to respond to your doctor if you go for a checkup. Health checkups give us real-time snapshots of our health and can illuminate health issues that may need to be addressed. All right, so delaying it is not going to delay treatment, or it's not going to delay the inevitable, but prevention is better than cure. I know we've heard that all the time. So my goal is at the end of today's podcast that you would be convinced of the importance and the relevance of going for a checkup. You would also know what to expect at the different stages of life and how to approach it when you talk to your doctor. Let's get started. All right, so why is it important to go to your doctor? It's certainly important because of our annual physicals. If you do not measure, you cannot manage, right? And the only time you get your vitals, nobody wakes up and says, I want to check my blood pressure, I want to check my pulse. So when you go for your annual physical once a year, regardless of whatever age you are, you will find out what your pulse is, what your blood pressure is. You will know what your respiration rate, your temperature, your oxygenation. Those are your basic vitals, all right? We can also assess your pain level if there's any pain. So if I'm looking at an age between 18 or even younger, vitals are always done at your annual physical. So even if you feel good, please go check your blood pressure. Hypertension on its own has been known to be the silent killer. Some people might have symptoms like headaches, blurred vision, but some people don't feel anything. And that's because your heart will continue to function and expand to overly compensate for the high pressure. So you do not want to say because you're feeling okay that you don't check. So it's so important to visit your doctor. Of course, find a doctor that will listen to you, take the time to educate you and not be condescending, but you will definitely get your vitals checked. And then if you have any concerns that you can bring up, but you will also get a physical where they listen to your heart, your lungs. As you might already know, that cardiovascular disease is the number one killer in both women and men. So you get a chance to have your heart listened to. I remember listening to a patient's heart. He hadn't seen a doctor in a while, and I heard atrial fib. There was arrhythmia, and the good news was that it was one that was not chronic. It had just started because of high caffeine levels, and he adjusted it and was fine. So you don't, I know people are afraid of bad news, but that's not always the case for every visit. And if there's something that is not, at optimal level, the doctor will give you recommendations on how to get it optimized. All right. So that is certainly one thing that happens during your physical. You get to do an intake about your lifestyle habits. For me, I'm a family physician, and I dive into your lifestyle habits. I dive into your nutrition. I always want to focus on the fact that you're eating plant-based foods. You're plant forward. So that doesn't necessarily mean that you have to be a vegetarian or a vegan. It just means that you are eating 80% of your food is plant forward. So the fruits, the vegetables, the whole grains, right? The legumes, the nuts and seeds. So you want to eat in that manner because that's where you get your fiber, that's where you get your minerals, your nutrients, you have your gut microbiome there. So that's conversation that you would have with your doctor, especially if it's a direct primary care doctor where they have enough time to sit with you. And so we focus on your nutrition. We also focus on your movement. I know as an able man, you're busy running around doing things, working. We want to make sure that you're doing strength training. Even though you don't lose muscle as much as women lose, but you need to build muscle because as we get older, there's a tendency to decrease in your testosterone level. So certainly strength training is important. We want to make sure that you are still flexible. So you're stretching. Cardio is also important for heart health. So that's definitely a question that we would have a conversation with you about. We would ask you where you are and make our recommendations. Recommendation at the moment is 150 minutes a week of moderate activity at a minimum. It could be more than that. We also want to make sure that you are sleeping well. Your behaviors, your sleep is important. A lot of great benefits. You have growth hormone that kicks in. You feel restored and refreshed. You help to get rid of any plaques that are in your brain that increases your risk for Alzheimer's, dementia. So sleep. Stress management is also important. Men keep a lot of things in, they bottle things in, and that causes high cortisol, that causes a lot of damage to the heart. And so you definitely want to make sure that you are proactive instead of reactive. And these are conversations that you would sit and talk with your doctor and come up with a good plan. Avoidance of substances is so important. You want to make sure that you are, some people use alcohol as a stress reliever, but it causes more damage. It could relax you at the moment, but what is it doing to your liver? It's toxic to your liver. So those conversations come out to just kind of make recommendations of how you can manage your stress without having to drink so much alcohol. Smoking is very risky. It increases your risk for heart disease. Just diving into substance abuse. And then, of course, social connections is something that we would emphasize and talk about. So these are the intake questions. Of course, what are the complaints that you might come up if you have any pains, if you have any concerns, and then we will go into the examination. Thank you so much for joining me on this week's episode. My goal on this podcast is to empower, educate, and encourage you to take actionable steps to triumph at living at your finest, body, mind, and spirit. Of note, the information provided here is for educational purposes only and does not substitute as medical advice. Please discuss your healthcare needs with your licensed medical professional. If you are in need of a compassionate and comprehensive holistic physician or know someone who is, please reach out through my website, livewellness.com, for a meet and greet. It will be my honor to talk to you. Are we connected on social media yet? I share more in-depth content on best practices to ensure that you live at your finest daily. So please join me on Facebook, Instagram, YouTube at Living at Your Finest Wellness, where we can learn together and stay connected. Lastly, Please subscribe to iTunes if you have not done so already, and share the podcast within your circle of influence. An extra step, leave a review and let me know what topics or discussions you would like to hear more of. Thanks in advance. It is always a thing of joy to hear from you. Now, let's get back to today's episode. Examination. Some of you might not like this. Majority of people don't, but your waist circumference is something that we want to check because it is an indicator of visceral fat level. So what is visceral fat? Visceral fat is the fat that is around your organs, which encroaches on your organs. It should be 10 or less. At my practice, I have an in-body scan that I use to gauge where you are. Now, it's not for shame or anything. It's just to provide informative data to help you improve on those goals, right? So we check your waist circumference. For men, it shouldn't be more than 45 inches. Women, it's 35. And then we also check your waist circumference. We check your weight. Now, BMI, the basal metabolic index, used to be one. I mean, it's still being used, but I'm sure it's going to be thrown off the roof very soon because it's based on population. It's not targeted to individual. So anything greater than 25 is considered overweight, and if it's greater than 30 is considered obese, and there are different classes of obesity. Now, in my practice, I have an in-body scan, and I love my in-body scan because it tells me what your percentage body fat is, which is a better indicator of your metabolic health. Percentage body fat should be between 10 and 20 with an average of 15. All right. So I love the data that I get with this because for my men at the practice, we have data to guide and provide an action plan. And they follow it. They use it as a guide and they come back and they've met their goals, right? With an action plan. And just going on the scale and knowing what your weight is, what does that tell you? Does it tell you what your skeletal muscle is, what your body fat is, if there's inflammation or not? So these are the things that we check. Of course, the examination is going to be a thorough examination from head to toe, making sure that nothing is out of place. And if something is out of place, we'll sit down and come up with a plan. All right. So that's the examination. And then blood work. Now, let's talk about some of the blood work that you should get. And it's so important, especially based on age. So anyone from 18 and above, if there is a family history of diabetes or cholesterol, and if your BMI is high, you definitely have to check your cholesterol. You have to check your A1C. All right. We want to make sure that your liver is fine. So the basic labs, you'll be comprehensive metabolic panel, your CBC, which is your complete blood count. We would also check your thyroid, check vitamin D, because a lot of us are low in vitamin D and it's important for bone health. All right. Other things would be the cholesterol and the A1C. Now, depending on the history and the examination, you might do further testing. Now, that's between 18 and 39. Anyone between 40 and 65, definitely a prostate blood test will be important to have done. You want that checked. Unfortunately, prostate cancer is becoming very rampant. Next to skin cancer for men, that's the second commonly seen cancer in men, prostate cancer. So you want to check. The guidelines used to be at 40, especially high risk African American family history, but then they changed that and said only if you're having symptoms. But now people don't even have symptoms, just a family history is what runs a PSA. I know sometimes patients ask, are you going to put your finger in my behind? Are you going to do a rectal exam? Well, certainly we will do a PSA first before a rectal exam. And a rectal exam, a digital rectal exam, is only needed if there's complaints of urinary hesitancy or poor stream. We want to see if the prostate is enlarged and if it has nodules. It kind of give us a gauge of whether we have benign prostate hyperplasia or if there's some form of cancer. But first and foremost, a PSA will be very important. Other blood works that you will do, those are the basic. And then we'll sit down and talk about what screening is needed. So between that 18 and 39, screening, not so much. When you're between 40 and 65, certainly you would need a colonoscopy. The guidelines have changed for that. A colonoscopy is so important. Increased risk of colon cancer, I'm amazed when I'm just baffled by how many people are having colon cancer now. So you don't want to ever dismiss blood in your stool and say that it's just hemorrhoids or it's a one-off. You want to talk to your doctor about it. So colonoscopies, and then again, the PSA is also under that class. You want to do your blood work. Anybody above 65, definitely the birthday gift is the pneumonia shot. And I didn't mention the vaccines. Vaccines, if you do take vaccines, recommendation is flu shot during the flu season, certainly COVID as is recommended. So these are things that you need to have checked in that order. So 65 and above, a DEXA scan, checking for osteoporosis, depending on risk. If you've been smoking, if you have a smoking history, you might get a CT scan of your lungs, because if you smoked for, the guidelines have changed quite a bit, but at the moment it's 20 years pack history, or if you've quit within 15 years, you need to have a CT scan of your lungs to make sure that there's nothing subtle hiding in there. All right. Other screenings, if you've smoked as well, you could get checking for aneurysm. Yeah, those are tests that you would have to discuss with your doctor. So it depends on your risk. It depends on your age, depends on what you have going on at the moment. So these are some of the things that you would have done when you go for your physical. All right. I want to end by sharing some other part of the examination that will be very important. Skin exam, especially for patients that are of the Caucasian race. You want, and if you're at increased risk for skin cancer, you want to make sure that you have a skin surveillance. If you have any new rash or any changes in your skin, you want to make sure that that is checked on a regular basis. You don't want to take anything for chances. Upper body, lower body, you want to make sure that that is monitored closely. All right. Now, a lot of questions that I get sometimes is around, what vitamin should I take, doctor? What really should I take? I see a lot of people taking vitamins. Let me end by saying that there are some basic vitamins that you should take. Vitamin D, as I mentioned, is one of the blood tests that is done. A lot of us are low and deficient in vitamin D, and it's so important for gut health. It's important for our immune system, important for bone health. So certainly vitamin D, but the dose is based on what your levels are. Another is omega-3 fatty acids, so important. It helps with cognition, brain health. So a good omega-3 is great. And then a multivitamin that has B complex in it and has all the great nutrients. Now, I'm not a big tablet person, so I try to get a lot of my nutrients in my food, but we do understand at the moment that our soil is just not as healthy and fortified as it used to be. So some of us might need that additional supplement. But again, the word is supplement, so don't take supplements and think that it's going to replace all the fruits and vegetables and nuts and seeds and legumes that you should be eating. I hope I've been able to convince you of the importance of going to the doctor. I promise you, it is not difficult. You have done hard things before. You have done great and mighty things. Please, we want our men to be strong. We do not want you dying of preventable diseases just because you don't have time or because you do not want to know. All right. Prevention is better than cure, and a stitch in 9 saves 9. What's that adage? Oh, goodness, I forget, but you know what I'm trying to say. So make this commitment. We have 6 more months left in the year. If you have not had a physical and you're in the Atlanta, Marietta area, it'll be my honor to provide you with a physical. I do have a membership-based practice. If you do not have a primary care doctor, it will be my honor to be your doctor. But if you are looking to just get a physical, I do offer one-time visits for physical. Quite comprehensive. It's about a 2-hour, 60, 90 minutes, depending on if you've had blood work done. My practice is a one-stop shop, and I'll be happy to sit with you and provide an action plan in a collaborative way without you feeling judged or feeling scared or learning anything that you don't need to know. All right. Thank you so much for listening to the podcast today. I hope it's been helpful and beneficial. Share it with the men in your life. Do it together. Go for your colonoscopies. Get your PSAs checked. Get your sugars checked. We can prevent chronic lifestyle-related diseases. I've seen it happen in my family. I know it can happen for you, but sitting still and not doing anything is not the answer. All right. Remember that you deserve to live at your finest because you're worth it. Take care and God bless.